at Chicago School of Public Health, SIU Medicine Center for Rural Health and Social Service Development, and the SIU Paul Simon Public Policy Institute. Today's webinar is the 8th of 9 webinars brought to you by these partners. And for those that have seen, we have used these webinars and the briefs that have accompanied each one to really dive deep into a number of different topic and focus areas, from aging population, mental health, public health systems, nutrition and fitness, children's growth and development, rural health workforce, opioids. Now today's presentation on healthy housing, and we'll kind of end with a sort of conclusion webinar, really thinking about economic development and its connection to really build healthier rural communities. What got us to this point of using this set of policy recommendations and webinars is that this Rural Health Summit Planning Committee convened 11 discussion forums to better understand and address the COVID-19 pandemic in rural Illinois. 80 leaders from 55 organizations in fields such as public health, healthcare, academia, industry, and government met virtually to discuss how the pandemic is creating new challenges, as well as also fostering innovation. Now, as we head towards nearly 21 months of the pandemic, we continue to see how it's having really difficult effects across all kinds of sectors, but it's really leading to many members of our communities doing really exciting things that we can build on and encourage as we get into an environment post-pandemic. The discussion forum participants were invited to additional sessions also to identify common challenges and synthesize impactful solutions. Some of the information, anecdotes, and issues raised in our briefs and in the conversation today will come from those discussion forum sessions. And so our goal for these Rural Health Summit reports was, one, to provide all of you and those interested in information about our rural communities in Illinois, but also to think about recommendations and action steps. We started off in March with really sort of a foundational brief about building a healthier rural Illinois, understanding and addressing the challenges of COVID-19. Then, as we saw each month, we had a specific brief focused on a topic with 3 policy recommendations, in which we've seen some innovation in our state. We've seen some other states sort of do interesting things and sort of describe potential models and action steps that the state of Illinois and each of our communities can really think about and work together to advance the health of our rural communities. We'll get into those housing recommendations a little bit later in our brief with Dr. Baker, but wanted all of our participants to know that each of these briefs and those recommendations are available at the Rural Health Summit website as part of the SIU School of Medicine overall website. So with that introduction, it's my incredible pleasure to introduce Dr. Linda Renee Baker, who will serve as our moderator today. Dr. Baker joined the Paul Simon Public Policy Institute on March 18th, 2003, after stepping down as the Secretary of the Illinois Department of Human Services, a post she held for 3 years. Her focus at the Institute is to expand access to high-quality healthcare in partnership with the SIU School of Medicine and helping minorities and people with disabilities realize their full potential. During her career in public service, Dr. Baker held increasingly responsible positions in a variety of state agencies. She previously served as Director of the Department of Employment Security, Assistant Director of the Department of Public Aid, and as the first African-American legislative liaison for an Illinois governor. Dr. Baker was instrumental in the first Rural Health Summit partnership that happened all the way back in 2003 under the leadership of the great late Senator Paul Simon, and was a key partner as we tried to think about ways to bring back the summit and really find an opportunity to talk about really interesting and captivating issues in our rural communities and as they relate to health. And so it's my incredible pleasure to hand this off to Dr. Baker, who will serve as the moderator and introduce our wonderful participants today.
Good afternoon, and thank you very much for that introduction, Dr. Vora. Today, we have with us an exciting panel of individuals that have really done a tremendous amount of work in the housing arena. These individuals have really worked hard since the pandemic and even before. We know that the pandemic has uncovered some real issues with respect to housing in communities across our state, but specifically as it relates to rural communities. It is my pleasure at this time to introduce our first panelist, Ms. Amy Bichetti, who currently works as a community revitalization and planning specialist with ILIDA, the Illinois Housing and Development Authority. She's been providing technical assistance for communities throughout the state of Illinois for the past 5 years. She's been working in some of the rural areas such as Cairo, Decatur, and Mount Sterling. Prior to joining ILIDA, Amy worked in community development and affordable housing. She holds a master's degree in urban planning from the University of Chicago and a bachelor's of arts degree from Tulane University. So please join me in welcoming Amy as one of our panelists today. We're also pleased to have another panelist who is certainly a veteran in the housing arena, especially when it comes to senior housing. Karen Zauzel has served as the executive director for the Illinois Affordable Assisted Living Coalition, AALC. It's a trade association that represents supportive living communities throughout the state of Illinois, providing housing for low-income seniors. More than 12,000 seniors live in those apartments, seniors and individuals with disabilities. Karen holds a bachelor's of arts degree in political science from Yale University, a master's of art in international policy studies, and a certificate from Middlebury, and also a JD degree from George Washington School of Law. We also have with us today Meredith Montgomery. Meredith is a strong advocate for supportive housing. She is the policy advocate and coordinator of supportive housing. She is passionate about the fact that everyone should have safe, affordable housing choices. She's worked in homelessness programs for the past 13 years, and she successfully led programs in Will County. Meredith has been successful and received several awards for her work in the housing arena. Meredith holds a bachelor's of arts degree in sociology from the University of Chicago, and she's currently serving as the board chair-elect for the United Way on the Will County Board of Directors. Please join me in welcoming our panelists today. We know that housing and homelessness is a great issue, and many have talked about what we do with this issue, especially in light of the pandemic. And rural homelessness is often regarded as one of those invisible issues due to the lack of data. So I would first like to start off by asking our panelists, how has the lack of rural specific housing data affected the work that you do? And we will start off with Amy.
Thank you, Dr. Baker. At IDA, we use almost exclusively publicly available data. So census data and Bureau of Labor statistics, that kind of thing. And so really our main problems with data, particularly in rural areas, are timeliness, because we don't get census data. We won't get the 2020 census data until hopefully January of 2022. And we're hoping on that. We don't know that for sure. So really our main issue with getting data about rural issues in general is really just timeliness.
Okay, thank you. Karen.
Thank you, Dr. Baker, for having me join you today for this very important conversation. I think, The Affordable Assisted Living Coalition represents Illinois supportive living providers across the state. There are 155 communities in 72 counties, so we certainly have communities in rural locations. When you think about challenges related to data collection, and those challenges may be perhaps exacerbated by the pandemic, I think for us, one of the challenges is certainly, access to data and the availability of data, but also for us making sure that we likewise are educating the population that we serve and that they are aware of the services that we provide. I think in terms of data and understanding where we can best locate supportive living program communities to serve the rural population, our last market study was conducted in 2015, and so the coalition this year on their list of things to do is going to be partnering with an organization to conduct a statewide market study to understand where the needs are, and in particular we'll be focusing on those rural locations. In our situation, our providers pair housing with access to important medical services, and so that's an important component. I think COVID has actually exacerbated again our work. We haven't been able to get out to communities. That's part of the issue as well. I'm sure we'll touch on that later. But thank you. Thank you.
Okay, Meredith.
Thank you, and good afternoon, everyone. So I am from the Supportive Housing Providers Association. We're a statewide network of supportive housing providers who work with both the folks who are experiencing literal homelessness and the folks who are at risk of institutionalization or exiting institutions. So when I think about data, in general, homelessness data is a challenge, right? We have very limited systems, which means shelters or outreach throughout the state. So we don't have the ability to get a clear picture on homelessness in general. In the homeless response, we have a go-to data point called the point in time, which is a day where we do like a snapshot. So on a single night in Illinois, we can tell you, experiencing homelessness that night. And the way that that is conducted is by using something called the Homeless Management Information System, which is a database that is unique to each of the 19 continuums of care. And I'll talk about what that is later in the state. So each state or each of the continuums have their unique databases managed by their own teams. And so obviously the first thing I'll say is the capacity in our rural communities is much lower as they get lower funding. They have different infrastructure issues just from the capacity to manage those systems. The other way that, so that counts the folks who are in shelters or in an actual place that's providing services. The other way that we get this number is we do a literal outreach effort during a certain point in time where we, a certain amount of hours where we're going into the streets and trying to find people. And as you can imagine, in a rural community where COCs range from 11 counties to I think 25 counties, it's very hard to do that complete comprehensive count. And then there's a lot more spaces where people are not going to be found. So I want to talk about point in time because in reviewing it for this panel, there are some really significant things about our rural communities. So 6 continuums in our state participate in this learning collaborative as a rural community. And sorry to go into this, but on a normal night in the whole state of Illinois, 1,431 people are recorded as homeless in this year. That in Illinois normal is a 2%, like the whole state, is a 2% increase of the year before. And our unsheltered population, or people who are not sleeping who are not sleeping in a place like who are outside, that increased 22% in the state of Illinois. And our chronic population, which is people who have a disabling condition and long-term homelessness, increased 34% in Illinois. So those are the statewide numbers. When I looked at these 6 communities, I was blown away. The 6 communities The overall increase, the percent from 2019 to 2020, was a 10% increase in homelessness. Those are the rural communities in our state. Our unsheltered was 87%. It's just huge. That is a huge increase over our state average, which is already over the national average. And then our chronic. Our chronic is arguably our most vulnerable individuals, those who have have disabling conditions, medical conditions, and obviously can't be treated. You all, we are our health experts on the phone, know how hard it is to treat somebody with medical conditions if they do not have a home. The chronic homeless population in rural communities increased by 149%. So it's just off the charts of the amount of increase of folks. So while data is hard in general to collect, it's very telling with what we have, the significant need and vulnerabilities of our rural communities in Illinois. And so with that, thank you, Dr. Baker. Thank you.
Okay, so as we think about data, we know that data drives policy decisions, and we look at things like the Build Back Better Act that's on the table right now, and all of the different programs to help those individuals. So collecting data and making sure that at the community level, we have data to be able to drive decision making. And so a question for Amy, how is IDA currently working with rural communities in Illinois, and in what ways are we positioning ourselves as a state to be able to receive funds from the Build Back Better Act when those funds become available to assist with homelessness in the state of Illinois?
Thanks, Dr. Baker. IDA is doing quite a lot of work in rural communities throughout Illinois right now. I'm part of the community revitalization program, and we provide technical assistance free of charge to rural and smaller communities throughout the state on a overall community revitalization planning process. So we actually help staff up communities and provide that capacity within the rural towns and villages that may not have that staff capacity to be able to do planning. We're able to do community outreach in these smaller cities as well. And so we have that planning process. We work with them on low-income housing tax credit applications for those locations as well. Our IDA has a land bank technical assistance program, a capacity program that helps provide funding and feasibility studies for land banks throughout the state. We have a number of those active in rural areas throughout the state. Additionally, we have any number of homeowner resources, including single family rehab programs, roof repair programs, weatherization. We have currently, the Illinois Housing Blueprint is in its second year. We're conducting listening sessions throughout the state in order to do a statewide housing plan for Illinois. We're currently in the second year of that process and are recruiting participants for surveys and listening sessions throughout the state all winter. That will be published in the spring. In general, we do quite a lot of work throughout rural communities. Have noticed that with the Build Back Better Act, in addition to COVID relief funding and emergency funding that we've already received, we currently have the second round of the Illinois Rental Payment Program open as of December 6th. That's offering eligible applicants. So if you're a tenant who has fallen behind on your rent due to COVID-19 job or income losses, we're able to offer up to $25,000 in emergency rental assistance for applicants that apply before January 9th, and that's throughout the state. In the first round, we accepted something like 78,000 applications from renters and landlords throughout the state. This is a program where tenants work together with their landlords to get that application put together and send it in to us. And as for positioning ourselves better for the funding and that may be coming from the Build Back Better Act, should that be passed and signed by the president. We've also begun conversations, that are ongoing and continuations from conversations we've had with Dr. Vora and the SIU crew there on health and housing. As we all know, housing is healthcare. And so we have been working with Christine Haley, the new state homelessness chief, on ways that we can all position ourselves and work together better in order to address those homeless issues throughout the state.
Okay, thank you. Karen, what are some of the challenges? You work with the elderly population. What are some of the challenges that you are facing, are seeing with respect to the elderly population? Many have been isolated, have not been able to get out to doctor's offices. What kind of challenges have you seen as you work with the elderly population and populations with disabilities?
Sure. Thanks so much, Linda. Great question. So obviously our population was hit tremendously hard by COVID-19. Those living in our communities were impacted. Not only those, living outside the communities, but those in our communities were impacted because, we were closed down just like other long-term care facilities. And so, having to close our doors to family members and kind of, stop or halt communal dining, some of the programming and services that are of benefit to our residents who live in our communities, came to a stop at the height of COVID and now have been reintroduced as we've moved through the pandemic. But that had a tremendous impact on, the mental and physical health of our residents. I will say, I think, however, I think the pandemic also highlights why the supportive living program is so critical and important, especially to those seniors or persons with disability living in rural Illinois. So, instead of being isolated in their homes without perhaps access to care or services within the supportive living communities, there is still a support system in place that allowed our residents to be able to access the services that they needed. And I think, it just shows the value that the supportive living program offers. So again, just to remind everyone who is not familiar with the supportive living program, you can think of it as assisted living for low-income seniors or persons with disabilities. And so everyone has their own individual apartment, which allowed us to pretty effectively and swiftly put in place mitigation measures. And so while our residents weren't able to perhaps enjoy, communal dining or go to the beauty shop like maybe, they were accustomed to, they were still able, to have meals brought to them. They were still able to access some of those services, transportation to medical appointments or having providers see them in the community. So all of those things that were made much more complicated for seniors or persons with disabilities living alone in a home and not a part of a community. Yeah, I'll pause there. I could go on, but I'll pause there.
Okay, what impact has this had on dementia care? I know dementia care is one of the hallmarks of the supportive living program, which is a new piece. Talk a little bit about dementia care in this population.
Sure, good question. So certainly we've seen in this particular population, the isolation has exacerbated or accelerated the effects of dementia. In 2019, August 2019, the Department of Healthcare and Family Services approved 41 new dementia care sites. Unfortunately, because of the pandemic, only those that are incorporated within an existing facility were able to open. We haven't seen any new construction. And so there are 36 approved sites, that hopefully will be coming online in the coming years, months. This has had a tremendous impact. The state needs to have these sites operational. It provides an alternative to nursing home care. Research shows that those afflicted with dementia and Alzheimer's do better in the least restrictive environment. And so, the fact that we haven't been able to move forward with development in this area, I think is hurting the state as a whole.
Thank you. Meredith, what are some of the key observations that you have seen specifically in rural areas in working with the homeless population during the pandemic?
Thank you. So, I would just like to give you just a little bit of a input on kind of what the work we've done. So SHPA is again, an association agency, which means that we work to, like, one of our hallmarks, the most important thing that I feel like we do is gain input from stakeholders throughout the state. So folks who are providers, people who are living in communities, lawmakers, and of course, people with lived experience. So we also are advocates. Our job is to advocate for resources to improve the homeless response system and to expand supportive housing in the state of Illinois. We've really done some interesting work over the last few months because the homeless response system in the state of Illinois, especially the crisis system, which is the shelters, the street outreach, and the system that responds to the actual crisis of homelessness, is very under-resourced in the state. So we've been doing a lot of work groups around that. And so when we talk to our rural communities, um, so it first of all, infrastructure in general is an issue for the state of Illinois for the crisis response. But as we talk to our rural communities, the homeless response issue or homeless response system looks like one or two projects in a very large community. I asked one of our leaders yesterday, what should I say on this panel? And they shared that what I would say is, if do not become homeless in a rural community. It's very hard to get connected to services. One of the largest issues is because of the large community space. Like, it takes a long time to get to services. So that is one of the biggest issues, is that the amount of services is it's very hard to get to services. And so when we're thinking about planning, like when the homeless systems plan to respond to homelessness, um, it looks like providers who are doing all of the work. So they're doing everything from homelessness prevention, like implementing those IDA funds that we talked about earlier, to shelter, to housing, and everything in between. So when they have, there's a lot of demands from the federal government for planning and system performances and bettering your community. The capacity of the rural communities, just simply because they don't get the funding to do planning and they don't have the infrastructure, um, to do planning exclusively. I think that that's a big issue. Is that they're competing because every day people are coming to the doors. So that's got to be their focus. So it's harder to do the strategies or to implement strategies or to bring everybody to the table in a rural setting or a rural community, um, simply because the table in one space is so far from the people that is served, if that makes any sense. So I don't know if I answered your question, but it's if I didn't, please, Doctor, direct me.
Thank you very much. And
Thanks.
to add to that, Amy, and when we think about leveraging existing resources, we hear Meredith talk about the landscape and how it takes time to move from one place to another. The landscape is very different. It's not compact, it's not contiguous in a rural area. So how do you think we can leverage existing government and local resources to gain a better understanding of the rural landscape? And I'll give that question to Amy.
Thanks. That's an interesting question, and I think it has a lot to do with simply breaking down the silos between the different agencies and organizations in rural areas in Illinois. When I started working for state government 5 years ago, there were obviously some agency contacts between IDA and IDHS and DCEO and several of the other agencies. But for me, those relationships with those other statewide agencies are really the best way to help the highest number of people, and the people who are located the farthest away from those services. If we can, because I might have more information on a certain rural community than Meredith might know, and Meredith might know someone else who would be able to work in that community. So I really think those relationships and breaking down those silos are one of the most important ways that we can really harness all of those disparate government resources that can all come together and figure out a way to work together to bring those services where they're needed.
Okay, thank you. And then Karen, just in terms of wraparound services, how can we provide wraparound services to integrate, perhaps? I know you do that with the supportive living programs, but what are some of the ways that we can better integrate services to address the needs of the at-risk population in these rural areas?
Excellent. Good question. So, I mean, I really think, again, that kind of reflects the value of the supportive living program model. And I think that's why it will be so important, this market study that we're going to conduct to identify, whether the state needs to reconsider reopening the program to allow for additional providers, especially in rural areas. Because, what you're describing, our supportive living program communities do exactly that. They address not only the housing piece of the problem, but also the healthcare piece through the services that they offer. And so, I know the state is exploring in 5 areas a pilot program with PACE, for example. There are other models, that the state could look at. But I really feel strongly that, it's important for us to, you mentioned data at the outset of our conversation, to review the data and identify whether it might be time, to expand the supportive living program. We've already, as we talked about, we have plans, to move forward with operationalizing some more communities to address Alzheimer's and dementia care, memory care, but supportive living program communities, the application process has been closed for the last several years. And so I think it will be important to identify, if it's time to revisit opening the program, because, exactly what you're describing, integrating the services with the housing, that's what we do. And I think we've proven that the supportive living program does it very effectively and successfully.
Okay. And Karen, you
I don't know if that answers your question.
Yes, and to that point, you mentioned PACE program. Talk a little bit about for our viewers what the PACE program is about and what that program is supposed to do for seniors living in rural and underserved areas. What is that program about?
Yeah, I mean, I'm not going to lie, I'm not the expert on the PACE program. And I know the state is just starting to wade into this with the identification of 5 areas throughout the state. But this will be another opportunity to provide coordinated services to our seniors and those who qualify. Linda, quite frankly, you might be more expert on the topic than myself if you want to speak about it. I know from my perspective, I've been looking at how other states that already have a PACE program in place, how they coordinate with assisted living or affordable assisted living. And so thinking through how we can work together with the PACE program rather than in competition. I think, an important piece of all of this is to think about, how we are coordinating at a strategic level of various resources that are coming to our communities and working together rather than, competing for the same populations or competing for those resources. So I don't know if you want to talk a little bit about PACE.
Yeah. Well, I think absolutely, and I think I'll go to a question actually that kind of leads into that from someone from the audience has a question. Do you think that the social capital of a community affects how well they assist the homeless, i.e. a community that has a lot of interconnections, and are they more able to assist the homeless through informal channels?
Right. I mean, one of our panelists already talked about infrastructure, right? And those relationships that you're describing, I mean, that is a form of infrastructure, you know, so having the ability, you know, not only physical infrastructure, but those relationships in place, and having a community that is, you know, aggressively addressing the problem and more aware and has the ability to connect, you know, a particular individual with the appropriate resources. I have an example, just an anecdotal example. I recently was meeting with a provider, one of our communities, their corporate headquarters actually yesterday, and they happened to have a homeless individual that happened to just be uncovered as sleeping, you know, in their parking lot. But because, you know, they were involved in supportive living, they were able to very quickly connect him within that day to one of their communities. Now, if he had been just, you know, a couple blocks away in a different, you know, location, would he have been connected with those services as readily? Perhaps not, right? I mean, that's just an example. Others on the panel, other thoughts?
Yeah, Meredith, I'd really like to hear your response to that. When you think about social capital,
Hmm.
you've worked at the grassroots level with
Yeah.
communities. How do those informal channels assist?
So I have an anecdotal story too. So my background is I was the director of the Will Kendall and Grundy County Continuum of Care. So it was a very diverse continuum. And the interesting thing is, so Will County is Joliet, Illinois, and then as you go west, it becomes more rural. But HUD, who is our guiding force, does not you know, counted as rural. But the way that the rural areas worked together was just amazing because it was so relationship based. They knew each other. They were able to move people um, through to the services that they need. Um, but there's only so much of that that people can do, right? That's why we need to look towards systems of care and building the infrastructure and systems of care so that all people in crisis, you know, people in crisis are who we need to think of in this matter. And people in crisis may get lucky enough to show up at the agency, and that agency may be able to leverage their relationships with the other agencies, or that, you know, that staff person who they interact with, or that library, or that business owner. You know, it's very personal and relationship based, and those work amazingly when the person in crisis is lucky enough to find them. A system of care is able to make that person in crisis's experience at resolving crisis mirror that relationship success, right? It's just we take those relationships and create partnerships among the agencies. Then we teach our agencies or our providers or whatever, whoever is doing the work, we teach them how to make those connections so that it is not just based on like Meredith and Linda. We work very well together, and if I meet the person who is homeless today, I'll call Linda. She'll be able to make things work. They're very successful for who they're successful for, but we want to figure out how to leverage that relationship, that culture up into a system so that it is a process that makes people in crisis be able to resolve their services. So I hope that I know we didn't talk about it, and I said I would, just an overview because I asked who's on the call. So a continuum of care, I just want to do this from the homeless side, just a moment. That is the entity responsible for a geographic region, and they are responsible for creating the strategies that help prevent and end homelessness. So we have 19 of them in the state of Illinois. They're established by the Federal Department of Housing and Human Development. So for folks who don't know that, I wanted to share. They work very hard every year completing essentially a strategic plan and submitting it to HUD and compete for funding for housing in your communities, for specifically for the homeless population. it is very important that those entities are able to build, to have the infrastructure to do what I was just talking about, those systems. And so, as I see who's on the call today, it's really important that COCs and our healthcare providers, including hospitals or FQOs, federal qualified housing systems, our MAP people, our housing authorities, our community members, we get to the tables to create the infrastructure for those systems so that people in crisis are served efficiently. And I think I'll stop there for right now. Hope that helped. Thanks.
Absolutely. Let's talk a little bit about housing stock. We know that infrastructure matters. So I will turn this question over. I know that we talked about the supportive living programs, looking at the possibility of maybe looking for more areas and have not had any new construction in quite some time. But let's go to Amy and talk about how does the lack of new housing in stock impact rural communities?
That is an issue that we see in almost every community in Illinois, but in rural communities specifically, the housing stock does tend to be much older. Many of our smaller communities have a very limited amount of rental housing stock, especially multifamily rental housing stock. And in addition to which we see some amount anecdotally mostly, but some NIMBYism, that not in my backyard, when we talk about bringing in affordable housing, workforce housing into some of these smaller communities. And so we at IDA anyway, and when we're working in a lot of these rural towns, find ourselves doing a lot of myth busting about affordable housing, about the types of individuals who would live in affordable housing and workforce housing. And what we have begun doing actually is whenever we're working in communities throughout the state, is we pull up a list of HUD funded and IDA funded housing. So subsidized housing, but it's affordable to people making somewhere usually between 60 and 80% of the area median income. And we will pull our list of housing that's available in the overall region. And we've started taking community leaders on tours. So we will go around to the affordable housing in the area, whether it's in the county. If we can have them meet with other elected officials in other communities, we do that. And in many cases, the housing that we're building through IDA with the low income housing tax credit that's aimed at, workforce, we've got, teachers, police officers, childcare workers, retail workers. This is the housing these folks are in need of because they qualify for the income. And in many cases, that housing that's built with the low income housing tax credit is going to be the nicest rental housing in town. It will be the newest rental housing in town. It will have updated features and amenities. It will have the updated plumbing and the counters and everything that people look for when they're looking for decent, safe housing for themselves and their families. And so our counter to the old housing stock that we do see in much of the state of Illinois is simply showing people what new affordable housing can look like and where we can have it throughout the state. And we found that to be a really important thing to do, is to be able to show people that. Because there are a lot of misconceptions around affordable housing and subsidized housing. And it's our duty, I think, as individuals who are working in these rural communities to show what housing can be and how people can be living.
Okay. And just to follow up on that, are there any innovative programs in the region that you're working on, Amy, that you would like to share with the group?
Well, in general, and Sean Park mentioned in the chat, we've been working through the Illinois Institute for Rural Affairs, and really we just go into these communities and help them do planning if they don't have the staff capacity to do so, and we're able to offer that service free of charge. So we're able to walk a community through an entire community planning process. We do housing stock surveys with phone apps. And so that's a really important way to be able to bring in volunteers that can help with this process. We're able to do that community outreach with surveys, whether that's online or paper. And really for us, it all really, again, just comes down to relationships within these communities.
Okay, great. Thank you. Meredith, as we look at some of the work that you have been doing, are there any specific projects that you've worked on that you would like to share with the group?
Well, yes. So the thing I want to talk about is one of our most awesome accomplishments this year was the day that the governor signed the executive order to establish an Illinois interagency task force on homelessness. I heard we talk about Chief Haley. And so I want to talk about that for just a moment. So the last 2 weeks, SHPA has been working very closely with Chief Haley to go throughout the state to do listening sessions on homelessness. One of the themes we're hearing a lot is that, okay, so the task force is going to be made up of two councils. The first are state agencies. The second is Community Advisory Council. And that Community Advisory Council has, a specific like layout of who they want, like, continuum care, people with experience, different types of advocates. So people that they want on the task force, it's expressed in the executive order. And so when we are in these meetings, we're hearing that it is very important to both the state and the community experts that we have a person who can be a leader for rural issues. So the first thing I would say is that as you all are considering steps forward, I think it would be really important to think about who might be a great representative to that task force and think about applying to be appointed to that task force. And I think that that application happens on the Illinois government website because it's a governor appointment. So I think that would be really a great idea because rural homelessness is very different. And I think so that is something I would want to lift up. In general, we work on a lot of advocacy, and our point is that we do statewide advocacy. So when we have great relationships with providers and continuums throughout the state who do contribute to, to our worksheets, to our, when I'm doing data and stuff. So we're working on our budget advocacy that's going to happen in the beginning of the year based on, data. So we're also looking at the opportunity to ask the state to appropriate money from the emergency relief funding to, again, improve the homeless response system and to expand supportive housing. So right now we're looking at creating a very strong ask for those components. So I hope that as we are finalizing that, we would be able to share with this group. We do have it very regional specific. So that's kind of the thing that is very important to us, that we make sure when we're saying, hey, we want housing, we're going to say, hey, this is what this community needs, and this is what this community needs. And, that's how we want to be distributing funding. So those are things that I'm very excited about. Healthcare is housing, and having this conversation and being a part of this conversation, I'm very grateful for. I know we have a lot of work to do in our rural communities. There's a lot of access issues, and then therefore there's a lot of, exasperated health issues among the homeless, and health issues leads to homelessness, and it is exasperated once homeless. So I really am grateful to be a part of this. So thank you.
Okay. One of the things that one of our former Surgeon Generals talked about, and that was David Satcher, there is no health without mental health. And we hear that and we know that. And so as we think about homelessness and we think about facilities, we've talked about facilities or we've talked about programming in communities for seniors and persons with disabilities. What about housing for those individuals that have mental health issues? Have we seen, we talked about dementia care and services for those individuals, but what happens in communities, especially in rural areas, when we talk about housing and homelessness being invisible and oftentimes people not talking about it? What are your thoughts on, or your observations on the whole issue of mental health and housing?
So permanent supportive housing is one of our evidence-based models of supportive housing. And so a few years ago, we started working on prioritizing housing for people who have the most severe issues in permanent supportive housing. It's the most intense intervention. You receive the most support. So supportive services is very critical to people who are experiencing homelessness. Homelessness is a trauma. Going through the systems is challenging, and supportive services at any level is important. Permanent supportive housing is a great model for people who are struggling with mental illness or substance use. Housing first is very critical. We don't need to provide conditions to housing. People need housing as a platform to receive and to be active in care that they choose, and empowered to choose. So permanent supportive housing can be site-based, which means that programs are developed in the community, buildings are developed in the community and owned by agencies, or it can be scattered site, and they're successful too, where we work with landlords. But the services is the critical part. And so again, another plug for advocacy, we get a lot of our service funding from the state of Illinois. So as you might hear from me if you are a supportive housing provider member, but that advocacy is very important to make sure that the state continues to fund the supportive services, but then also, we have an exacerbated issue, so we'll be looking to increase that too. Thanks.
All right. So another question that came in is homelessness. We talk about rural and underserved areas. Are we seeing a difference between rural homelessness and urban homelessness, and what methods are most effective when providing outreach to homeless individuals or housing insecure persons in the population? And so that's a question. I guess I'll ask one of the other two panelists. Meredith, we'll come back to you. Why don't we go to Amy?
Not being a direct service provider, I'm not sure how thoroughly I can answer this question. But I mean, anecdotally, I would think that in rural areas, you would see a lot more doubling up in population, more than you would see street homelessness. And you'd probably see a lot more involvement with churches and schools than you may see in urban environments. But again, not being a direct service provider, just can't speak that well to it.
Okay. All right. So, and I know the listening sessions that you're doing around, and Meredith, you want to chime in again on that one?
Thank you, and I appreciate it. This is a huge passion of mine, and I'm lucky to be able to work in this field, so thank you. I think I want to go back to the data that I just said. The very vulnerable, so the people we're able to record who are homeless in rural areas are extremely vulnerable, and the vulnerable populations are increasing. So I think the things to think about as we're doing outreach and as we're implementing philosophies is to think about evidence-based philosophies. So a housing first approach is very critical, which means that you are working on getting people into housing and then working with them based on their direction for services, what they need. The other thing to think about are things like harm reduction, motivational interviewing. So those are best practices that I think are, as I understand, are kind of newer in the implementation of the homeless world. And the federal government started talking to us about it, and we then have to figure out how to get it, implemented all the way down here with no funding, to the providers at the beginning. So, helping, build a culture among our providers of those evidence-based practices is very important. I'll talk about when I started in the homeless field just for a moment. When I started, it was about 2010, and we had an agency where we had people who are starting to work with evidence-based practices like Housing First, and then people who maybe had been in the field a little bit longer, who learned, who thought that they maybe had a better idea of how this person would end their homelessness. And they, it's very much like you had to earn housing, you had to do this, and you had to do that before this person's crisis could resolve. And so what we saw was the most vulnerable folks, the hardest to house folks, were not getting housed, were not leaving homelessness, and therefore their became more vulnerable, they stayed homeless longer, and they started distrusting systems. As you have people experiencing homelessness who are distrusting systems, and other people who are coming into homelessness, the word of mouth between people in that same experience is critical. So, you know, anyway, so that's what I'm saying, is that one of the best outreach is to implement best practices, best practices all over. And without resources, that could be hard. One of our services is technical assistance. That's something we can do, but just having that cultural change of housing is the solution to homelessness. Support services is the way that people achieve stability, but they can't do it without housing. So, thank you.
Okay, thank you. Absolutely, yes, housing is certainly the solution to homelessness, and we're going to share some of the policy recommendations that have come out of the work that we have been doing on this issue. One is to create an Illinois Rural Housing Solutions Task Force to commission a set of recommendations to better collect housing data and develop housing need assessments specifically for rural communities. And I know we talked about some of those listening sessions, and some of that may work very well with the creation of this group. And then encouraging hospitals and local public health departments to use community needs assessment and I-plans to study and address housing and other social determinants of health. Again, housing is the solution to homelessness, but again, data drives decision making. And then the pilot, the creation of a rural community care center or community centers to encourage a system of linking healthcare and housing to other social services needs. Again, service integration, understanding that housing issues cannot be resolved on their own, that it takes a team of individuals working together to resolve the homelessness issue. And when we think about the group that we have here today, having folks from the Illinois Housing Development Authority and the work that they do, not in one community, but in all communities, the work that they are doing, working with our federal lawmakers as well as our state lawmakers. We have the Housing Task Force in the Illinois House of Representatives. We know that the Senate doesn't have a housing task force. So one of the recommendations and comments that has come up is the fact that, working with the Illinois State Senate to develop a housing committee, to have a champion or champions to work on housing issues across the state of Illinois, understanding that housing issues are there in rural areas as well as underserved communities across the state of Illinois. So with that, I'm going to stop and ask each of our panelists for closing remarks as we get ready to end today's session. We will start with Amy.
Thanks, Dr. Baker. And I'd like to thank Meredith and Karen for being here today. And just really appreciate this opportunity to talk about rural housing and connecting it with rural healthcare. And just have gotten a lot out of these relationships and webinars with SIU and with SHPA and with other agencies around the communities. And I just really wanted to thank you for the opportunity.
Thank you. Karen.
Likewise, I want to echo your sentiments. Thank you so much for the opportunity to be here and share with you. I just want to reiterate, what a vital role the supportive living program communities play in offering affordable housing to seniors and persons with disabilities. And I think another component of that is continuing to advocate for appropriate resources so the program can continue sustain itself. Something that we didn't get into at all, our focus was a little bit more obviously on the housing dilemma, but when you're thinking about supportive living program communities, they're also offering services, and we didn't even touch on the staffing issue that our communities are grappling with in the wake of COVID. And so, so vitally important that the state of Illinois, continues to support the program and fund it adequately, and even, consider reopening the program as it looks at the needs of our seniors and persons with disabilities, especially in our rural communities. So thank you so much, Dr. Baker, for the opportunity to be here. Really appreciate it. And thank you to my other panelists. I look forward to continuing the conversation and helping, contribute to this important work in whatever way possible. Thank you.
And I believe that leaves me. I want to say the same thing. What an amazing group of panelists today. And it's just, I've learned a lot in the hour we've been here. I've put my contact information in the box. Thank you so much for lifting up rural homelessness. And thank you for coming together. Your brief that you had on your website is amazing. And I think that you have some really great ideas. The thing that I want to lean on the most is what Dr. Baker said just a few minutes ago. This work takes all of us, and it takes urgency. And sometimes it takes common sense too. Like, let's get that Senate involved. The House Housing Committee has been amazing, and let's bring it to the Senate, and let's keep moving forward so that Illinois can be a place where all Illinoisans have a home that meets their needs. And I just want to thank you so much, and I look forward to working with you all in 2022.
Okay. All right. Safe, affordable, and sustainable housing for all. And we know that housing is the solution to homelessness. I want to thank all of you for your participation in this webinar today. Our next webinar is set for January 20th, 2022 at noon, COVID-19 and the rural economic development. Please scan the QR code and sign up today. Thank you again to our panelists for your input, and we look forward to working with you in the days ahead to solve the issues surrounding homelessness in our communities. Thank you very much for your participation today.
Thank you, Dr. Baker, for your excellent moderation. Looking forward to seeing everybody on January 20th, and we wish everybody a very happy holiday season. Thank you to our panelists as well. Goodbye.
Thank you.